Peace be to you all. Assalamu alaikum. Omar here, physician assistant, doctor of health education, moderately fit, middle-aged athlete, and family man. So I wanted to talk to you guys very briefly about your success in physician assistant or physician associate school. Now, some people have referred to this as a crash course in medical school. I don't know about that. If anything, I would call it the highly abridged version of medical school. PA school differs from medical school in that the subject material in PA school does not have anywhere near the depth or breadth of medical school. So in medical school, students take anatomy. It's not the same thing as gross anatomy, where you're dissecting a cadaver. We went to the cadaver lab as PA students. I graduated from PA school almost 25 years ago. So we had access to the cadavers, but we went through the cadavers after the medical students had dissected them. So they had first dibs on the cadavers. And we had about a week's worth of neuroanatomy, where the medical students took a whole course in anatomy. We had about a week's worth of embryology, where the medical students took a whole course in embryology. So the depth and breadth was markedly different between the two programs. PA school rather, helps you have what I would call a good understanding of the basics of medicine. So internal medicine. Most of us work in primary care medicine. I think that's where we're best suited coming out of PA school. That's what I've always done for the past almost 25 years, is work mainly in internal medicine. I just saw my last patient about an hour ago here in a private practice. I think we're well suited for that. When you get to your final year of PA school, you're doing your rotations with third and fourth year medical students. And the attendings and the various residents, the chief residents, are grilling you just like they do the third and fourth year med students. And they expect you to know your information. So it comes at you very quickly. Some people liken it to trying to drink water from a fire hydrant. You know, it may be doable, but it's very difficult to do. So you have to, I say all that to say it's very important that you find out which study technique works best for you. Now, as an educator, I say this not with any arrogance, but my doctorate is in health education. So specifically, I've had courses in health education, but educational theory, that kind of thing. I've put many of these things to the test in the classroom and with my patients. So how do people learn? What's the most efficacious way to disseminate very complicated and voluminous information into a very short, understandable format, such that it can be successfully utilized, for patients and students alike. So during my sojourn as a professor, adjunct professor, I should say, but a professor nonetheless, I had students who were on different scales in terms of how they understood information. So if I was teaching a course in, say, the renal system, and we're covering the various clinical manifestations of pathology, whether it's kidney stones or kidney failure, that kind of thing. Some students were able to get it right off the bat. Others, it took a lot of tutoring. It took them, a long time to really get that information. So, you have to figure out which system works best for you. And you don't have a lot of time. I've had students one student I remember was a non-traditional student in her 40s, and she was called me crying, like saying, "I don't know how to study. I can't seem to process all of this information that's coming to me." And I've had students who had to drop out of school. They weren't able to kind of get all that information in the brief amount of time that something as intense as the PA program demands it. It's only a 2-year program. It's 1 year of didactics where you take anatomy, physiology, pathophysiology, pharmacology, what else? Clinical chemistry, those kind of courses that you need when you start your rotations. So the rotations are in internal medicine, emergency medicine, surgery, OBGYN, pediatrics, and again, you're expected to function on a fairly high level for a student, for a PA student. It's that can be very difficult. So it challenges you. I found it to be a challenge mentally, spiritually, and physically, because we were on call sometimes. We had to spend the night in the hospital. So find out very quickly what type of learner you are. There's a lot of good tools on the internet now. I find that I'm a very visual learner, so I have to have silly mnemonics, to help me remember things. And I also enjoy reading. So now that I passed my board recertification exam, thank God, alhamdulillah, I don't have to take it to the year 2034. I'll be, 66 by then, Lord willing, if I'm still alive, inshallah. Might even be retired or dead, who knows. But now I can read for pleasure, and not like I've got to, I'm under the gun, so to speak, for studying for an exam. I also have to do, the thing about being a PA and even being a physician, you have to do something called continuing medical education credits, category 1 and category 2. There's a distinction between those. So you're going to be attending conferences or reading medical journals. You've got to be able to understand these things, because ultimately it's about, efficiently taking care of your patient so they can have the best clinical outcomes. Anyway, that's it for now. For those of you guys that are interested in being a physician assistant, or now called a physician associate, feel free to reach out to me. Also, if you want to be a health educator, you can reach out to me as well. It's both are great professions, but I enjoy being a PA. It's been a great almost 25-year career, and I'm looking forward to the evolution of this PA career. Okay, guys, I wish you guys the best of success in your PA endeavors. It is PA Week, October 6th through October 12th. Take care. Peace.